öğleden sonraki oturumuna da hoş geldiniz. Biraz gecikmeyle de olsa bugünkü programımıza şimdi başlayabiliyoruz. Gecikme için özür diler ve umarım başarılı bir şekilde bu bir saatlik oturumu birlikte tamamlayabiliriz. İlk konuşmacımız Mr. Noel Sader, kendisi Fransa'dan geliyor ve kendisi Gilles Sezam şirketinin yöneticilerinden. Sunumu için kendisini buraya davet ediyorum. Mr. Nader, please.
Okay, good afternoon, ladies and gentlemen. So I will try to make my presentation in the allocated time frame. And I'm going to start with an overview of the situation regarding to cross-border healthcare in Europe. First of all, I would like to address special thanks to Gemalto and the Prime Key Solution that kindly invited me to this conference. So what are the cross-border healthcare inside the EU facts and figures? 1% of total public health expenditure represents the cross-border healthcare in Europe. That's to say about 10 billion of euro per year. That's to say 3 or up to 4% of the citizens, the EU population, which means more or less, let's say, nearly 15 million of people. And the appreciation of this phenomenon remains, however, questionable, since we don't have really comprehensive figures for the whole picture. Okay, now the regulation. Where we are with the regulation. The member states, the European Parliament decided to, the member states or the European Council decided to facilitate and support cooperation for the exchange of information amongst member states, working with a voluntary network connecting national authorities responsible for e-health. So what are the objectives? Among the objectives, I will just mention to work towards delivering sustainable economic and social benefits of the European health system for mobile citizens and withdrawing administrative and technical barriers against mobility of citizens. The aim is to accompany and foster citizens' mobility and, in the end, to have a common labor market for 500 million of citizens and workers. Last but not least, to support member states in developing common identification and authentication measure or means to facilitate transferability of data in cross-border healthcare. And this is a part of the directive, European directive, that was approved by the member states and the European Parliament by this year in 2011. So what are the services now? The 883/04 regulation is applicable since the 1st May 2010. It includes or encompasses all branches of the social protection sector, including health, family benefit, pension, job seeker benefits, and some others. It has been decided by the member states that all the cross-border paper form will be withdrawn and replaced by structured electronic documents. This project is so-called ESI, which means Electronic Exchange of Social Security Information. However, data exchange via ESI are only based on asynchronous messaging systems between social security organizations. This means that there are no direct links or connection between the healthcare delivery location, between the health practitioner and the competent institution. That's basically missing in the ESI project. So we'll see what are the pan-European initiatives that try to bridge the gap between ESI and the healthcare front desk application at the point of care. So in a few words, here you have a picture of ESI. Can I take the microphone and walk? Because it's not convenient to stay all the time here. If you have the microphone. Thank you. You can see that we have here, but what is basically ESI? ESI is a backbone for a secure data exchange amongst the member states. Yes, please. And this backbone is now still under construction. Thank you very much. Is it working? Okay, thank you. Can you hear me? I don't think, okay, thank you. So it's already available, and it's standing on the former S-Testa network, so-called S-Testa. And this network is devoted for secure electronic exchange of documents or information among the member states dealing with all the social security sector. It's similar to the Schengen network. So it's a Schengen for the social protection, let's say. So the backbone and the AC by itself as such is already financed by the European Union, and it's delivering service only to connect or to interconnect the member states. And all the link between AC and the national or local health information system are under the competency and the responsibility, including the founding of the member states. That's more or less the picture we have right now. And shortly saying, the first application providing access to the competent institution repository is under test at the moment. Since the first question that the health practitioner, for example, if you are in Germany and I have a French health insurance card, then the first question that the German physician needs to answer is where to send the bill. So he has to identify the competent institution. Okay. So we are dealing now, we'll introduce an outcome, let's say, summary of achievement by the pan-European project NetCards. So what is NetCards? First, NetCards is a consortium of 30 partners and sponsors and also observers from 18 European member states and other states, like Norway, for example, or Liechtenstein or Switzerland. Among them, 20 health and social insurance organizations or regional healthcare authority, technical organization acting on behalf of the HIO, hospital health professional association, and sponsor from the smart card industry. So the total investment is of 20 million euro, and the European Union co-funding is around 30% of the eligible costs. So you have the list of the member states or other states participating in this project, which has started almost 10 years ago, now is nearly to close. So what is the business case? As already introduced, there are no link between the health practitioner and AC at the moment, no direct link. That's what NetCard is aiming to implement. So from the 1st June 2004, the European Health Insurance Card, you can see it here on the bottom of the screen, is the proof of entitlement to receive unplanned health care everywhere in Europe, provided that you have a social insurance somewhere in another member state, which is not your home member state, actually. So at the moment, there are nearly 2,000 millions of European health insurance cards circulating. That's to say that more than 1/3 of the population has received this card. In case of a HIC no-show, or in the case of the HIC is expired, then a provisory replacement certificate can be delivered by the competent institution. That's to say that the payment of the healthcare service is guaranteed by the EHIC, the iReadable EHIC, which is not a chip card, provided that the expiry date is not reached. So basically, it happens that more than 50% of the patients, they don't hold a valid EHIC just when they need it at the point of care. And this is a real issue, because there is a cost, of course, to issue that EHIC. So NetCard service is based on the following use case: that the EHIC is optically captured by the healthcare practitioner at the point of healthcare delivery, and if case of EHIC no-show or the EHIC is expired, then the patient entitlement can be verified online by the data set, which is captured from a national health insurance card
or an ID card. The concept behind that is to say that, well, I don't need a specific European document to prove my social right if I'm traveling all around Europe for business or for leisure or for whatever reason. I just can use my regular social insurance card as I can use my driving license or my ID card. And then the cost savings are potentially 2,000 billion of euro at least. So subsequently, the eHIC dataset is processed by both statistic purpose and back office e-billing reconciliations. So I will not go through technical details. I just show here an example of Italian patient receiving healthcare in France. What happens in the field? The health practitioner first has to authenticate himself or herself with the national health practitioner card, which is a microprocessor card. Then either the eHIC is valid, then he or she will scan the eHIC readable information and then process it into an XML dataset, or if the eHIC is not anymore valid, to read the chip of the Italian patient and then connect to the national portal, which is here in this case located in France. Sorry. Afterwards, after this authentication of the health practitioner, the French portal will connect to the Italian portal through a secure connection based on the Internet SSL v3 standards. And then afterwards, the French physician is able to download the Italian application to read the Italian dataset. Once that's done, then the submission form is electronically sent through this dual connection from the healthcare practitioner workstation up to the Italian portal, which will route the query, the submission to the relevant competent back office system. While the back office system, for example, in the region of Lombardy, will check the data that was been submitted from the Italian card. If these data are available and it is verified that the patient is insured in Italy, then the health practitioner is able to download the electronic form and then send it to the billing department. That's more or less, roughly said, the way it works. So this system has been audited according to a common security policy, and most of the countries participating in the project have been audited and also awarded. That's to say that they have fulfilled the security criteria while processing the audit. And to my knowledge, it's a unique example of a common security criteria that are implemented at pan-European level amongst member states for a common service. In the end, we have got 16 national access points. We have got 637 service points amongst 328 hospitals or health centers, disseminated or spread amongst the 16 participating countries. So for the common citizen, you just have to type in www.healthcareabroad.eu, and then in the language of your computer, you can show through a Google map. I don't have an internet connection here, but it's very easy to check. You can see where you can receive healthcare abroad, depending on the country you want to go to visit in Europe. So the transaction breakdown by car type are here shown. We have 53% of eHIC European health insurance cards from the NetCard participating country. This means that half of the patients that were treated in NetCard service point were from these countries. We have in yellow 38% of NetCard of patients coming from non-NetCard countries, like the UK, for example. And then in the end, you have only around 9% of patients showing a national health insurance smart card, an electronic card, for example, a German card or a French card, Austrian, Italian, or Slovenian. So just would like to show that from the April 2009 until March 2011, the flow, transaction flow have been growing regularly and periodically. And even if the flow are weak, the picture shows that it was a successful implementation of the service in the 600 and more service points. So I'm going to conclude. The social economic benefits are, first of all, to improve the quality of service to citizens. In case of EHIC no-show, for example, fostering citizen mobility inside the Union, no need of specific portal document for cross-border healthcare entitlement anymore, cost savings for administrative costs for the healthcare professional can dramatically reduce the administrative burden, online verification at the point of care limits fraudulent usage, empowers trust direct payment from the HIO to HCP, and EHIC specific cost could be saved, since if I consider that one EHIC costs €1, then I can save for the health insurance organization at least 2,000 million of euro. There are some outstanding issues. I will not go through all of them. I'll just say that those countries who decided to continue the service after closing of the European funding period have already implemented the service in their local or national health information system. So the bottlenecks mainly are the front desk application, also the back office system, but the front desk application is a real crucial criteria for long-term sustainable implementation. So the way forward after 10 years, some countries like Austria, Switzerland, Czech Republic, Germany, Liechtenstein, Netherlands, Slovakia, Poland decided to continue the service, and even after the contract closing, so that's to say they will fund the service at their own fund. Some others decided to stop at the moment, like France, Finland, and the Italian region of Lombardy. So that's the vision for netcards, netcards providing online verification at the point of care from the healthcare practitioner location office, and thus providing additional online services based on trusted parties and through the European and pan-European network SE. So in conclusion, netcards has successfully demonstrated cost-effective solution to improve cross-border healthcare delivery. Long-term sustainability of the business model is subject to national or regional regulation, as well as interoperability issue within the local information system. Replacement of paper form by the structured electronic document has been decided by the European member anyway. It's in the law. Stepwise integration of cross-border real-time smart and online services is a key factor for the successful introduction in the health and social sector in Europe. And finally, last but not least, full integration of cross-border e-services is a matter of political decision at both European and national or regional level. That's it for now. I did my best. Are there any questions? Thank you very much.
Thank you very much, Mr. Nader, for this presentation. We will have a questions and answers part after we finish with all the presentations, and I will proceed in Turkish. Ms. Sevda Öz, Sağlık Bakanlığı'ndan bugün burada EFSOS projeleriyle ilgili olarak bize bilgi verecek kendileri. Kendisi ICT danışmanı ve Sağlık Bakanlığı çatısı altında çeşitli Avrupa Birliği projelerinde koordinatör olarak görev almıştır. Lütfen kendisini kürsüye alabilir miyiz?